Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. Thank you for joining me at GYN Corner here today, and thank you for tolerating the last presentation. I was a little bit on the go. I was trying to squeeze that one in because I really just wanted to get that information out, and I was at the train station. I realized, hey, I can probably give the first part of it now. So it was a little bit short. I think it was, well, short for me. 5 to 6 minutes is short for me. So I got the introduction out on the COLOGARD testing, and today's the second part. So I'll do a brief recap from yesterday, was yesterday for me, but the previous presentation for anyone who did not catch it. So everyone is supposed to be screened for colon cancer. And what we call the gold standard, or the best test to screen for colon cancer, is a colonoscopy. Colonoscopy is a camera that's placed up your bottom and goes through your intestines and evaluates the lining of your intestines to see if there are any masses, growths, abnormal lesions, ulcerations, any abnormal tissue changes that would indicate problems. Biopsies are obtained, sent to the pathology lab, and a diagnosis is made. So that's gold standard. That's the best we have at determining if someone is fine or not fine. And the American College of Gastroenterologists has recommended that everyone who is 50 years old and over is tested regularly with a colonoscopy. Now that's been the standard, but 2 years ago in May of 2018, the age range was decreased. So they decreased the range, what was previously one colonoscopy between 50 and 55, and then the frequency determined based on that patient's medical history, family history, risk factors, and that colonoscopy is made. That age range decreased to 45 years old. So everyone who's 45 and is supposed to get one colonoscopy between 45 and 50. So 45 years and older is the recommendation for a colonoscopy. Now it used to be 50. And I'll just add as a side note, anyone who has or had a parent who has had a diagnosis of colon cancer, if you had a parent who was diagnosed with colon cancer and they were under 50 years old, then you as the child is recommended to have a colonoscopy done at least 10 years prior to your parent's diagnosis, because that puts you at an increased risk, hereditary risk of developing colon cancer. So that being said, the colonoscopy, as I mentioned in the previous episode, does have its limitations. So first off, is limited by how well you can clean out your colon so that the GI doctor, the gastroenterologist, can actually see the tissue lining the intestines to see if there's a problem. So if you can't do the prep very well, you're leaving patches of stool or clumps of stool, they're not going to see the lining well, and you're going to have a poor colonoscopy evaluation. They can't see everything. They can miss aspects that might have been picked up had everything been clean and visible and visualized well. Secondly, it's obvious to me, but it's not always obvious to me. It's dependent on the doctor who's doing the colonoscopy, because not everyone has the same adeptness at doing procedures. So if that doctor can't maneuver around the hooks and bends and nooks and crannies in your intestine well, they can't reach every place in the colon appropriately, they don't see all of those corners and hooks and nooks and crannies, they're not going to be able to tell you if it looks normal or not, and biopsy anything that looks irregular. And I have had patients tell me that the GI doctor couldn't complete the colonoscopy, there was a bin they couldn't get around, so that plays a factor. And then I guess lastly, it's your anatomy. So if you have scar tissue or adhesive bands that's pulling the intestines one way or the other, if you've had abdominal surgery in the past, you can potentially have the bowel adhesed and stuck and scarred to different areas, and they may not be able to get to those areas in the best of hands because it's matted abnormally in a pattern that they're not going to be able to get around. So all things being considered, the colonoscopy, though, is the best we have to offer at screening and diagnosing and hopefully preventing colon cancer, because that's the purpose of it. Now, the COLOGARD is an at-home test, which is second best at screening for colon cancer, and it's precursor, so precancerous changes. As I mentioned in the previous episode, I have absolutely no affiliation with the COLOGARD testing kit, nor with the company. Exact Sciences Corporation is the company that produced it. I have absolutely no affiliation, no monetary remuneration from them. I just think it's really, really nice that we have an alternative, because until this kit was available, we didn't have a great alternative. Now, the COLOGARD, as I stated, is an at-home test you obtain, has a big long list of instructions on how the patient obtains a stool sample and sends it to them. The stool is then analyzed for genetic material, so it looks for DNA in combination with or without red blood cells or intestinal bleeding that's microscopic. So it looks for DNA of abnormal growth, so polyps, precancerous changes, ulcerative changes, any abnormal kind of lining of the intestinal system. All of the lining inside the intestines, all those cells exfoliate on their own. So the purpose of that is to pick up those exfoliated cells that exhibit abnormal genetic material. And sorry, I just got a message from the girls in the front to pick that up and to let me just buzz, to identify the DNA and to alert you that there's a problem. So it's looking for abnormal genetic material. If it picks up that abnormal genetic material, then obviously the recommendation is a colonoscopy. He's here? Oh. Dr. Bird? Oh, okay, sorry, I thought Tamara sent me a message. Sorry. So, if you come back normal, no abnormal genetic material, then you don't need to do anything further except repeat the COLOGARD. It's every 3 years. So the COLOGARD is recommended by the American Cancer Society to be done every 3 years if you're 45 years and over. Unless, because of course there's always restrictions, unless you fall into one of the restrictive categories. So those restrictive categories are if you have a history of cancer already, because obviously it is looking to see if you're at risk or if you already have very early colon cancer. So if you do, then you're not a candidate for the screening. Secondly, if you have a history of precancerous changes, because it's checking to see if you have precancerous changes. If you already know you have precancerous changes, there's no sense in doing the testing because you already have that information. Secondly, if you have a strong family history of colon cancer, say you have a parent who had colon cancer, it's not recommended because even the small miss rate that it has is not really acceptable when you have a high risk of having a problem. So the higher your risk of having a problem, the more important it is for you to have a colonoscopy or the full diagnostic test. So it's only for people at an average or a low risk of having precancer and cancer of the colon. And then lastly, the older we get, the higher our risk of colon cancer. Same with breast. The older we get, the higher our risk of breast cancer. Older we get, the higher our risk of colon cancer. So I always say women for everything. Women and men 75 years and older are not recommended to have the COLOGARD because the risk increases so much that it's not worth it. But I'll add a little caveat that if someone's over 75 but they're not a good candidate for the colonoscopy for a procedure or for the anesthesia, because everyone gets IV sedation for the colonoscopy, or if they're not able to do the bowel prep well because they have maybe fluid balance issues, then it's better than nothing, right? So it's better than nothing for them, especially if they're in relatively otherwise good health and sound mind. They might as well do the COLOGARD, because at least there'll be some sense of relief if they come back at a low risk. That's my own little input. Now, the COLOGARD, of course, it's a screening test, so by definition, screening tests are never going to give you a 100% answer, but it has a really, really good sensitivity and specificity. So those are what I tell people, the believability rate. So the believability rate is really, really good for the COLOGARD. The sensitivity, which means the ability of that test to pick out who does have the disease, who has cancer, and who doesn't have it, how good it is at picking it out, like how good it is at picking out a needle out of the haystack, how sensitive it is at detecting the problem, is 92%. So that means the false report rate, or the false normal rate, is only 8%. So 8% of the time it'll tell someone they don't have the disease, pre-cancer, cancer issues of the colon, when they actually do. And the specificity, how great it is at picking out people who have the problem, or preventing a false positive, telling someone that they have pre-cancer cancer when they really don't. That false positive rate is only 13%, which means that the specificity is 87%. So that's really, really good. And what we call the negative predictive value. So when it says negative is good in medicine, so when it says someone's normal, how strongly in general can we trust that they're really normal? It's 99%. So it's a really, really good test. It's not as great as eyeballing directly and picking out the tissue and sending the tissue to pathology, but as far as being able to not have to have surgery, not have to have a procedure, not having to do the bowel prep or the cleanse, just pooping in the specimen container at home when they tell you to, that's a really, really good test. And the colonoscopy, as I said, now is recommended for 45 years and over. The frequency that someone has to do that colonoscopy depends on their risk factors and what the colonoscopy showed previously, but it could be as early as 1 year or as far out as 10 years. On average, a lot of patients I'm seeing, they're being told around 3 to 5 years to repeat the colonoscopy. As I say, the COLOGARD, that at-home test, is recommended as long as it comes back normal, low risk, every 3 years. And let's see, I forgot to mention that it's been available. The FDA approved it to be used since 2014. So it's been out for 6 years now. I find a lot of patients have not heard of it. So I mention it periodically when it appropriately comes up about someone not getting their colonoscopy done, or not wanting to do the colonoscopy, or maybe had a poor colonoscopy and they were told they need to repeat it. They don't want to repeat it, those kinds of things. So it has been available for a long time. It's a really, really good test, and all you have to do is ask your doctor to write you a prescription for it or to fill out a form. The company is exactlabs.com. That's their website, exact, exactlabs.com, exactlabs.com. You can go on the website and order it, and then your physician has to fill out a form or something. So you can go on the website, print out the form, and then bring it to your primary care physician, and they can fill it out and fax it to the COLOGARD people. Most of the insurance companies do pay for it. They'll either pay for it in full or they'll pay for it in part, because it's always with or without a deductible or co-insurance or prior authorization. But it's a really, really great alternative. So I hope that's been helpful information. It's been kind of a long presentation, but I hope that's been helpful information on an alternative to colonoscopy. And now that I think about it, I didn't really speak about colonoscopy. I spoke about it quite a bit, but if anyone has questions, just send me a message either through the Facebook, the YouTube, it's also GYN Corner on YouTube, or the podcast, GYN Corner. And if you want more information on the colonoscopy itself, I can do another presentation on that. Have a great rest of the day. If you enjoy the talks, hit the like, subscribe, follow buttons, and leave a review on Apple Podcasts to let others know what GYN Corner is about. Have a great rest of your day. Bye!